Here's a USMLE style question related to dilated right ventricle in pulmonary hypertension. USMLE question on dilated right ventricle in pulmonary hypertension. A 45-year-old woman with a history of systemic lupus erythematosus, SLE, presents to the clinic with worsening shortness of breath, fatigue, and swelling in her ankles over the past few months. On physical examination, she has a loud second heart sound, S2, an elevated jugular venous pressure, JVP, and peripheral edema. A chest X-ray shows enlargement of the right side of the heart. Echocardiography reveals a dilated right ventricle, RV, and right atrium, RA, with increased right ventricular systolic pressure. Question: which of the following is the most likely cause of the right ventricular dilation in this patient? Option A, left ventricular failure. Option B, chronic obstructive pulmonary disease, COPD. Option C, pulmonary embolism. Option D, pulmonary hypertension due to systemic lupus erythematosus, SLE. Option E, mitral stenosis. The correct answer is option D, pulmonary hypertension due to systemic lupus erythematosus. Explanation: this patient's clinical presentation with shortness of breath, elevated JVP, peripheral edema, and right ventricular dilation on echocardiography strongly suggests pulmonary hypertension, PH. TOCT. Pulmonary hypertension can cause increased afterload to the right ventricle, leading to right ventricular dilation and failure over time. SLE can cause pulmonary hypertension via a variety of mechanisms, including pulmonary vasculitis or autoimmune-induced pulmonary arterial remodeling. Left ventricular failure would typically result in a dilated left ventricle and could eventually cause secondary pulmonary hypertension due to back pressure in the lungs, but it's not the primary cause in this case. Chronic obstructive pulmonary disease, COPD, can lead to cor pulmonale, which causes right-sided heart failure due to pulmonary hypertension. Pulmonary embolism could lead to acute pulmonary hypertension, but this patient has a chronic presentation, making this less likely. Mitral stenosis can cause pulmonary congestion and secondary pulmonary hypertension, but the right ventricular dilation in this case is more consistent with primary pulmonary hypertension due to SLE. In patients with autoimmune diseases like SLE, pulmonary hypertension is a well-known complication. It's important to recognize this as a potential cause of right heart enlargement. Thank you for listening, and keep up the great work in your USMLE prep.